When we do a knee replacement, what we are actually doing is we're trying to resurface the worn out joint surfaces. So between two bones you have cartilage, and just let me just show you. This is what I mean by cartilage, the bluish structure here. This is the meniscus, but in addition to that there is articular cartilage. The smooth structure here, which is lining the bone at the end, is cartilage again. So that along with the meniscus and the cartilage covering the plateau here, all together forms cartilage which on which we walk. And when we walk and we move through, this smooth movement occurring between the two bones, right? And it's actually the cartilage moving over each other, and both are very smooth. But with age and with use and wear and tear, and you end up having cartilage wear and tear as well. So when this cartilage wears out and it becomes uneven and the bones rub against each other, that's when you get uneven surfaces, you get arthritis, you get a lot of pain. The cartilage is like your fingernail. You cut your fingernail, you don't get any pain. But when the cartilage wears off totally and your bone rubs against each other, that is very painful. It's kind of similar to, you know, cutting your nail too close to the skin, and it's very painful. This regenerates, but this does not. Over a period of time, when the cartilage is totally worn out and this totally bone is sitting on bone and rubbing against each other, that's when most patients would probably require a knee replacement surgery. By that time, their functional capacity would have decreased as well. Most patients would not be able to walk at even 10 minutes without pain. So those are the candidates that we counsel for a knee replacement surgery. So when we do a knee replacement, what I do is the initial incision is in the front of the knee, and then we have to kind of take this to the side, and we work through all the bones and tissues here, kind of replacing them and with the metal and plastic. I'll just take another model in this place, and there that goes. So this is what a knee replacement would look like after it's done. So what we've done is, if you actually look at it, we haven't taken off any of the bone really. It's more, we just shape the cartilage and the surface. So it's really in effect a surface replacement. So when you look at that, that is the surface. That is the metal component that goes on top of the bone. So we've shaped the bone to get a nice 5 different surfaces: the anterior, posterior, chamfers, and the distal cut. Now we also make some lug holes here in the center, and based on the type of replacement, whether if it's a posterior cruciate substituting implant, then we cut out a small notch as well. So then this goes on top of that there. The tibial surface is prepared by using a saw, where we take off the cartilage, and then we make a small heel to fit the heel of the tibial prosthesis. We make a small little hole in there, which appears like that. So this goes into that, and we into this base plate, which is made of metal, we implant a plastic, which is polyethylene, and then put this thing back on top. So once this is done, this is what your knee replacement looks like. So if you have a bowed leg, it straightens out, because typically you would have worn out one side more than the other, and that's why your leg would have bowed out of shape. So when we're done with this and both are, you know, of equal size, then it kind of straightens up and the bow legs go away. And so now your metal and plastic rub against each other and not your bones, and that actually gives you relief of pain. And that's the simplest way to explain a knee replacement. It's just taking away the bearing surfaces and of bone and replacing them with metal and plastic.